Got it. Got it. Okay, so what's vital capacity? আচ্ছা, পরের কোশ্চেন আসছি। সো আমাদের 360 থেকে কোশ্চেন শুরু। 360 থেকে আমাদের কোশ্চেন শুরু। ওকে, সো 52-year-old to old woman present to the emergency department with the 6 weeks 6 weeks history to tiredness and unsteadiness to tiredness and unsteadiness. Right. A 52-year-old woman present with the emergency department with a 6 weeks history of tiredness and unsteadiness on her feet. Okay, then with cerebellum with some paresthesia affecting her legs. Okay, she has a 3-year history of hypothyroidism and diagnosed with type 2 diabetes mellitus 6 months earlier. Current medication thyroxine, metformin, and 500 milligrams. So she is a non-smoker and does not drink alcohol. Non-smoker doesn't. Her most recent blood test reveal normal thyroid function test, hemoglobin CO2 55.2. As mentioned, she has a small hypopigmented rash, small about the dorsum of her left hand. A small hypopigmented rash or dorsum of the left hand. She has a spastic paraparesis with a grade 4 power in the lower limb. And knee replace are diminished and ankle replace are lost. So knee replace diminished, ankle are lost. Bilaterally, okay, bilaterally, joint position since it is lost at the toe and at the ankle, toes and ankle, toes and ankle. There is a normal pain sensation. Pain sensation. What is the most likely diagnosis? That is syringomyelia, spinal cord meningioma, spinal metastasis, multiple sclerosis, and subacute combined degeneration of the cord. তার মানে joint position sense lost the toe and ankles, but there is normal pain sensation. There is normal pain sensation. Okay, গেল এটা। আচ্ছা, on a very small hypopigmented rash over the dorsum of the left hand. Dorsum of the left hand those is spastic paraparesis in the grade 4 in the lower limbs. This spastic paraparesis lower limb. আচ্ছা, knees replaced and diminished are diminished ankles are lost. তাহলে knee replaced or diminished ankles are lost. এদিকে হচ্ছে plantar response is extensor bilaterally. Plantar response extensor bilaterally. Extensor bilaterally. Bilaterally. আচ্ছা, উপরে একটু পড়ে আসি। 52-year-old woman present ED department 6 weeks history of tiredness and unsteadiness on her feet, with some paresthesia affecting her legs. She has a 3 year history of hypothyroidism and was diagnosed with type 2 diabetes 6 months earlier. Current medication thyroxine, metformin, and non-smoker and does not drink alcohol. Her most recent blood test revealed a normal thyroid function test and hemoglobin হচ্ছে এত। On examination, okay, তাহলে syringomyelia, spinal cord meningioma, spinal metastasis, multiple sclerosis, subacute combined degeneration of the cord. OD. She smoked at the cigarette, alcohol, and does not drink alcohol. Normal thyroid function test, hemoglobin হচ্ছে এত। Hypopigmented rash over the dorsum of the upper left hand, and she has a spastic paraparesis with the foregrade of the limb. Hypopigmented rash and the dorsum of the limb and spastic paraparesis. Spastic হচ্ছে four limbs. Systemic sclerosis. ভাবছিলাম But combined degeneration of the spinal cord, combined degeneration of the spinal cord is a metabolic disorder due to the vitamin B12 deficiency. The posterior column and corticospinal tract are superficially damaged, but clinically picture can be complicated. Maybe early involvement coexistent with the peripheral nerve damage. Symmetrical loss of posterior column produces ataxia with loss of joint position sense. Signs including the spasticity in the legs, hyperreflexia at the knees, and loss of ankle jerk and extensor plantar response. Occasionally, there may be an associated peripheral sensory neuropathy, although relative sparing spinal thalamic tract is typical. Treatment is with the hypocobalamin injection. তাহলে কি দিতে হবে? Cobalamin injection দিতে হবে, hypocobalamin injection, which improve the peripheral nerve damage. Although the resolution of the spinal cord function is not as always significant in this patient. Vitamin B12 deficiency may be due to the pernicious anemia. It is autoimmune disorder which is associated with the other organ-specific immunodisorder, thyroid disease, and vitiligo. Metformin reported the interfere with the vitamin metabolism, although clinically significant vitamin deficiency with respect to metformin use the virtually never reported. Okay. 307. So what is the most likely diagnosis? So malignant hyperthermia and is dose of the aware of effect and stiff person syndrome, peak of dose dyskinesia, neuroleptic malignant syndrome. Okay. This 7-year-old woman who was recently diagnosed as juvenile Parkinson disease was taking levodopa and carbidopa with fair control of her symptoms. She has brought to the ED with high fever and confusional state to test duration. Apparently, she has begun refusing medication, and her mother wonder whether she has a urinary tract infection. On examination, pulse rate was blood pressure 160/60, temperature to 40, diaphoresis was noted. She was drowsy and answered the question is irrelevantly. The cranial remarkable limbs are rigid, thyroid levels are normal. Fraser, okay. WBC, hemoglobin, urea, creatinine, cerebrospinal fluid. Okay, white cell has a two lymphocyte, red cell 20 milligram, 400 incubation glucose 7 millimole. Okay. What is the most likely diagnosis? Malignant hyperthermia and dose of wearing of effect, stiff person syndrome, peak dose of dyskinesia, neuromalignant syndrome. আচ্ছা, টেম্পারেচার 40 হয়ে গেছে, হার্ট রেট বাড়ছে, ব্লাড প্রেশার কমে গেছে, ড্রাউজি এন্ড ব্লেন্ড লিপিডোপা শুরু করছে, তাই না? লিপিডোপা কার্বিডোপা দ্য ফেয়ার কন্ট্রোল। আচ্ছা, এদিকে 7,400 20 red cell, 2 lymphocyte. তাহলে কি এটা নিউরোলেপটিক malignant like syndrome, peak of dose dyskinesia, stiff person syndrome, and dose wearing of effect, malignant hyperthermia. Neuroleptic malignant syndrome, এটা হয়। The clinical picture like the syndrome has been described in patient with the Parkinson's disease who suddenly stopped their levodopa treatment. Suddenly, a student has withdrawal of the drug is damned to lead to an acute deficiency of the state of the state patient who was iatrogenic, increase the dopamine transmission. Mortality 30%, 30% if it is not recognized and treated properly. Neuroleptic malignant syndrome consistent of generalized rigidity, hypothermia, stupor, unstable blood pressure, and blood pressure and profuse sweating. It is most commonly associated with the antipsychotic neuroleptic medication. Some patient hospitalized may rises up to patient hospital bar 6,000 উপরে হয় and can lead to the microalbuminuria and kidney disease. Treatment should be started early when the consciousness is first altered and temperature is rising. Temperature treatment is given by the reinstitution dopaminergic medication. Okay. Which of the following represents the most likely diagnosis? Most likely diagnosis. As a 36-year-old as a painter, as a decorator, presented with sudden onset painter sudden onset back pain. He was sitting on the floor painting efforts fancy when she reached after some time that she was unable to get up. On examination, she was bilateral leg to weakness with lower limb hyporeflexia. He has pinprick sensory loss to the level of the umbilicus. Vibration senses mildly impaired at the ankle and clearly present at the knee. তাহলে দেখেন bilateral leg weakness with the lower limb hyporeflexia is a pinprick sensory loss at the level of umbilicus. তাহলে মানে sensory level আছে pinprick sensory loss at the level of umbilicus. Sensory level that's definitive. Vibration senses mildly impaired in the ankles and clearly present at the knee. Urinary retention হচ্ছে. Past medical history of note include the hypertension, including the Remipil. The most likely diagnosis interspinal artery syndrome, cervical complex transverse myelitis, GBS, Miller Fisher, transverse myelitis, interspinal cord syndrome.